Welcome everyone to the Protein Showcase webinar hosted by the Protein Consortium. My name is Cherie Bryant. I'm Director of Communications for the European Association for the Study of Obesity. And it's been my pleasure to work with this team and be one of the EASO representatives within the consortium. So we all know how challenging it can be to eat healthily and take enough exercise. And these behaviors, healthy eating and regular physical activity, are really important and can have an impact on health outcomes. Research also tells us that each individual has different nutritional and physical activity opportunities, needs, and preferences. Generic recommendations, which we get all the time, don't work for everyone. One of the key strengths of this project is that we engaged individual consumers in the development process around the project. This helped to inform the development of the tools and content from the very beginning. Protein is a research initiative led by a consortium of 20 European public and private sector organizations from 11 countries, bringing together the worlds of IT and artificial intelligence with nutrition and public health. During the past 3.5 years, protein researchers have developed and tested an AI-based platform that can provide personalized nutrition and physical activity support for EU consumers. The protein platform is available to everyone through a mobile smartphone application, which we'll learn a lot more about during the webinar today. The Protein Initiative received funding from the European Union's Horizon 2020 Research and Innovation Program under grant agreement number 817732. Our program today will include presentations from protein researchers and collaborators. These folks will explain the motivation for this novel AI-based ecosystem and the interdisciplinary research collaboration, outline how researchers have integrated scientific knowledge around nutrition with AI algorithms to provide personalized nutrition support for consumers. And we'll showcase the Protein mobile app and expert dashboard that were developed and tested through this initiative. Presenters will also review some of our key findings and the unique innovation assets generated from the protein ecosystem. We'll conclude today with a roundtable discussion with protein partners. During the roundtable, we'll also address questions you might have. So please make note of your questions as you go along. You can include your questions in the chat and we'll do our best to comment on them as we go along and discuss them at the end. Before we get started, let's highlight a few webinar housekeeping items, please. Please stay on mute unless you're speaking. And if you have any questions around technical difficulties, the protein tools, or questions for our panelists, please use the chat feature of the webinar. It's now my pleasure to introduce our first speaker, Lazaros Gemopoulos from the Center for Research and Technology Hellas, CERT, and the Information Technologies Institute. A project quality assurance and risk manager, Lazaros has coordinated the protein project. Welcome, Lazaros.
Thank you, Cherie. Good evening, everyone from Thessaloniki, Greece. The aim of my presentation is to provide an overview of the protein project and of the various technologies that have been developed within. Detailed presentations of the various project aspects will follow. You are also invited to visit our website at protein-h2020.eu for more details, materials, and content. The Protein project is a European Union co-funded Research and Innovation Initiative under the Horizon 2020 Framework Program. It is a private and public sector partnership investigating if and how can modern ICT support personalized nutrition and physical activity advice, and aiming to promote balanced nutrition and a healthy lifestyle. But what was the motivation behind the Protein Project? I believe most of us will agree that healthy eating and physical activity are important health behaviors. It has been proved that they can help us mitigate the risk of non-communicable diseases such as obesity or type 2 diabetes. But eating healthy and exercising can be challenging for us due to environmental or other various barriers. This is the problem that Protein decided to take on. Our goal was to use the latest knowledge and information and communication technology to make it easier for all of us to engage in healthy eating and regular exercise. And we have developed a mobile application that can offer a personalized diet and activity plan to all. The Protein Consortium consists of 20 organizations from 11 European countries and includes industrial partners, small or medium-sized enterprises, research partners, as well as partners representing society overall. Among them, we have an ethical expert leading a dedicated ethics work package, VUB, the world's largest dedicated online grocery retailer, Ocado, one of the largest university hospitals in Europe, Charité, the most supported Portuguese football club, Benfica, and the Federation of 32 National Obesity Associations, EASO. The Protein Project team encompasses food system actors such as supermarkets, grocery shops, restaurants, facilitators, health experts, nutritionists, activity experts, and medical experts, information and communication technology experts, mainly artificial intelligence and machine learning experts, and various technologists, mobile, sensor, wearable, web, security, network technologists, and integrators. And finally, it encompasses partners who are representing the final users and patients. The objectives of the Protein Project were to model existing knowledge, to develop a system for personalized nutrition, to demonstrate and validate the protein system, to further disseminate and exploit project results, to communicate our vision and promote a healthy lifestyle, and to conduct responsible research and development and adhere to ethics requirements. The key objectives can be analyzed as follows. Objective 1 was to model existing knowledge and develop diet and activity requirements for user profiles belonging to various user groups. Objective 2 was to develop a system for personalized nutrition and activity advice using modern technologies, including artificial intelligence, and consisting of the Protein mobile application, the Protein web platform for experts supporting certain user groups. Objective 3 was to demonstrate and validate the Protein system in 3 real-life scenarios: the physical or online food store, restaurants or online delivery, and at home. Also gathering data for further scientific research in a series of 20 piloting activities across Europe. The user groups involved in and studied by Protein are the general public, for example, mobile application users, food retail customers, restaurant customers, students, etc., people under nutritionist supervision, people with excess weight and athletes, and people under nutritionist and medical supervision, people with poor quality diets or deficiencies, people with obesity, people with type 2 diabetes, and people with cardiovascular diseases. The Protein system combines user information, experts oversight, and information and communication technologies, and provides early warnings, for example, related to allergens, suboptimal eating patterns, etc., a personalized diet and physical activity plan for optimal health and well-being, a shopping list, and personalized suggestions when dining outside. In this final slide, you can see an overview of the protein system, which combines user information with experts' knowledge in order to provide personalized diet and activity advice through a mobile application, and also support through a dashboard for experts. Thank you very much, and do not forget to download our protein application from Google Play. Thank you, Sherry.
Thank you, Lazaros, for sharing the background and motivation for developing the initiative. If you could unshare your screen. As a reminder, we'll address your questions at the end of the webinar, but please do share them using the Zoom chat function. So in this next section, you'll hear from several protein researchers and scientists who have contributed to the project. In our pre-recorded video, you will first hear from Dr. Catherine Hart, who will describe how we have identified, prioritized, and integrated evidence-based nutrition recommendations into the protein algorithm. The second speaker, Dr. Konstantinos Rouskas, will describe how the algorithm was developed. We'll then hear from Dr. Kosmas Dimitropoulos, who will describe some of the key technical protein achievements. In this video, you'll also hear from Dr. Ian Paglos, who will explain how the protein ecosystem uses data to personalize nutrition recommendations. And finally, the last three presentations will be from Lazaros Gemopoulos, Duncan Russell, and Saverio Gravina, who will show you the protein mobile app and the protein expert dashboard. Let's start the video.
My name's Catherine Hart. I'm a senior lecturer from the University of Surrey in the UK, and we were responsible within this project for leading work package 3, which was about developing all the underpinning knowledge for the system. And there are kind of 3 key pieces of work that we did within that to develop the knowledge tracker, which is what we called it, the user profile, and the ontology. So the knowledge tracker, which was really our responsibility, was about bringing together all the key variables that would be of relevance to our users. So they fell into kind of 3 main groups. So we had dietary variables, so things like how much fat someone should be eating. We had physical activity variables, so for example, how many minutes of exercise. And we had physiological variables, so things like heart rate and glucose levels. And so, first of all, we had to choose which variables we were going to include, because obviously there's a huge range of things that we could include, but we had to try and narrow it down to the ones that were most relevant to our users, and then think about what the cut-offs would be. So by that we mean looking at the guidelines. So we're really lucky that across Europe there's some amazing, up-to-date evidence-based guidelines for things like, how much fat you should eat and how many minutes of exercise you should do. So we used that. We didn't try and reinvent the wheel. We tried to collate what was already out there and just really think about what was relevant for the particular population groups that were going to be involved in protein. So as an example, at Surrey, we're interested in users that have poor quality diet, so low levels of fruit and vegetables. So that was a relatively easy one to include in the tracker, because there's lots of evidence that says you should have 5 portions of fruit and veg. So that was our kind of target that we were aiming for. But we set lower levels, we set upper levels, and we looked at, in terms of converting this into something useful for the app, we had to think about how much lenience we would give people around those targets. So yes, we want everyone to have 5, but what would be the kind of acceptable range? So that was the knowledge tracker, say essentially a database of all that information for dietary, physiological variables and activity variables, but divided by all our different user groups with levels that we were hoping, target levels, but also upper and lower limits for those things. And that was the information that was then going to set the boundaries for the system that within which it would make its recommendations, and also to help set goals for people. The second piece of work was the user profile. So again, this was led by our partners in Leuven. And that was about priming the system. So what information do we have to put in about our users to help the system come up with its initial recommendations? That could be updated as they went along, so they could change their weight, for example, but really the key role of the user profile is to set the system up at the beginning and say, look, this is a person who has some excess weight and has a goal to increase fruit and vegetables, and they currently are avoiding gluten. So it's all that kind of information, so about their baseline health, their anthropometric measurements, any dietary preferences. Clearly we wanted to take those into account and not be recommending things straight off that they wouldn't eat. So that was what the user profile was about, was deciding which of those variables were crucial, which were nice to have, which were going to be entered by the user themselves and they could amend them, and which we were going to enter as health professionals and kind of have control over. So the third piece of work that we were helping to coordinate was the development of the ontology, and this was a huge amount of work that was led by Surf, and was about providing the technical link between the knowledge tracker that we've just described and the application. So trying to convert what we want people to be aiming for and the boundaries within which we want them to be eating and doing into a language that the application can use. So it's quite difficult to explain without diagrams, but essentially the NACT, which is what it was called, so the Nutrition and Activity Ontology, is a set of concepts and then the rules and relations that relate to them. So for example, we have 4 main areas within that. So we have foods, we have nutrients, we have activities, and we have conditions. And then for each of those, there's rules and relations. So to try and give you an example, something quite simple would be a relationship between a food and a nutrient. So for all the foods that featured in the meal plans, they were tagged with whether they were good sources of a particular nutrient, so that then that could be linked back. So if a user has a goal to increase their iron, then we know that these foods are the foods that are good sources of iron, and therefore they're the foods that want to appear in their meal plan. Another example would be if a user is in a particular condition related to their clinical presentation. So if someone has obesity, then that would trigger certain goals within the application. So by noting that that user is within that classification, it would then trigger goals for their diet and for their activity. So for example, to reduce the fat intake. And then obviously that would then link into using the ontology to which foods they should be having more of or less of. So it's really just the way that all the different concepts link together to allow the whole list of potential meals that we have within the system to be funneled down into those that are suitable for that user, based on what they've put into their user profile. So that's how these 3 areas that can seem a bit disparate actually all come together. So the user profile and the ontology are used to narrow down the whole list of potential meals and activities that are in the system into a smaller list that's appropriate for that user. And the knowledge tracker underpins all of that, because that sets the boundaries within which the system is working.
My name is Konstantinos Rouskas. I come from CERT, from Institute of Applied Biosciences in Thessaloniki. I'm a biologist, and I have an expertise in the genetics field, in the field of human genetics, how the genetic background is associated to different health issues or diseases. And at this moment we have started collecting all biological samples for analysis, and we are extremely happy that we will start the analysis right soon in order to test this direction, how the genetic background in particular is associated with personalized nutrition. And we hope that this procedure, this pathway can be used also from other projects in the near future. So based on the direction of the European Union regarding the One Health perspective, so healthy people, healthy environment, and in terms of the climate change that is significant part, very significant at this moment, we hope that the integration of this omics data, of these different kinds of biological data to this field, and how we incorporate this data with other types of real-world data will be useful for the health practitioners, but for the nutritionists and also for the general population. So we hope that they will serve as a baseline, as a first step towards a better understanding of human diseases and other related issues to health.
The main objective of the protein project is to develop an end-to-end ICT ecosystem for providing personalized nutrition support to the users in their everyday. The main characteristic of the system is the fact that it uses the knowledge of the experts, of nutrition experts, and combines this knowledge with data collected from the system. In order to do so, we use cutting-edge technology, mobile devices, wearable biosensor, and of course, artificial intelligence algorithms. The main component of the system is the Protein AI Advisor, which consists of an ensemble of AI agents. At the first stage, the system extracts a list of suitable meals, appropriate meals for the user, and then automatically synthesize the weekly and daily meal plans and physical activity plans of the user. The more data the system collects, the better personalization it provides. So we can say that the system learns from the user. Apart from the AI advisor system, the consortium has also developed a number of other AI algorithms. For instance, we have developed an AI algorithm for the automatic food recognition from still images, another algorithm for the eating rate analysis of the users from video sequences, and also algorithm for bowel sound analysis and breath analysis before and after the meal. But of course, the main goal of the project is to collect a big volume of data using this ICT ecosystem and then analyze this data using explainable AI algorithms. Our goal is to extract new knowledge related to specific behavioral dietary patterns of the user and also specific individual parameters.
So I'm Ion Pangalos. I'm an assistant professor at the Department of Nutritional Sciences and Dietetics of the International Hellenic University. I am a computer scientist and I'm really interested in what protein is doing, bridging the gap between technology and nutritionists. I teach nutrition informatics, which is a relatively new discipline. I specifically now deal with building a tool that helps nutritionists extract results about food choice. Because protein now has, after the pilots have run for quite some time, we now have important data about how this personalized application helps users make food choices. So we have plans that are suggested to the users, and then we have what they pick and their preferences, they rate the meals. So we have developed a tool that gathers all this, presents it to the nutritionists, and now what we're trying to do is try to make sense of that data. And this tool will build on some questions, some research questions, some hypotheses we have that will probably, hopefully lead us to a better understanding of why people choose the foods that they do, and some really interesting questions about how sustainable these choices are, for example, which is a really interesting topic right now. And me personally, I try to, be the conduit between technology and nutritionists. and I'm very personally interested in that. So one of the biggest achievements of Protein is that it has created a framework, a whole technological framework that can be easily reused in such personalized nutrition spaces. And we have many databases that have existing data like food items and their nutritional value, but also user data that reflect their preferences and their choices in food. So I'm really interested in seeing how we will package this at the end and create a reusable framework for personalized nutrition. One of the most interesting things happening right now is that we have the quantified self. So we have so many sensors that are able to track what we're doing, and we've reached the point where physical activity can be tracked to a fantastic degree. We all are wearing something like a smartwatch, and I really think that in the very near future we will be able to track food intake as well with sensors, and that will completely transform nutrition science and nutrition informatics, I mean, for me personally, as we know it, because we will have a nice basis of not user-submitted data, their perception of what nutrient intake is, but real values. And that will allow us, especially in systems like Protein, having access to devices that will be able to actually monitor food intake and have robust sensor-provided data instead of the user's perspective on what they eat, and these 24-hour recalls that unfortunately sometimes very subjective. I think that will transform nutritional sciences and nutrition informatics. And I think Protein is at a point right now where it can very easily take advantage of such devices. So one of the good things that one of the important things that Protein has done is that by building this framework, this ecosystem that is technologically up to date, we can easily add new devices as they get released. And this is definitely going to happen because I would be really interested in such a device. Who wouldn't? Having a way to track food intake and then analyze it.
The most important tool for the general population is a very simple application for smartphones, an Android application, which helps the user to acquire a proper diet based on his individual characteristics. I believe that the title of the project, Personalized Nutrition for Healthy Living, Protein, says many things about what we are doing in the project, and the mobile application helps us with the personalization of the instructions and the suggestions we provide to the user. Obviously, this can be done by the professionals directly, but many people do not have access or for many reasons cannot have the services of professional nutritionists and dietitians. And for them, having a very simple application that they can use to get basic suggestions and information about how they can improve their diet and acquire a proper diet is very important. At the same time, this same tool, along with a dashboard, can be used by the professionals themselves in cases where they support people that have special needs. For example, athletes, or people with diseases like type 2 diabetes or cardiovascular disease, or generally with all their clients.
Ocado Group is an online grocery technology company providing end-to-end e-commerce, logistics and fulfillment solutions for some of the world's largest grocery retailers. Ocado Group has been working with nutrition experts, researchers and IT leaders to develop the Protein solutions. We collaborated on the design of the Protein app and trialled the subsequent prototype app with Ocado.com customers and other online shoppers. Ocado Group was responsible for developing the automated shopping feature. With this feature, Protein users can shop for all ingredients necessary to prepare the meals for their personalized plan. The shopping list is automatically generated from the recommended meals that a user selects as on their plan, or from meals manually added by the user. Within the Protein app, the shopping functionality will match the ingredients from their meal plan to products available from the Ocado.com webshop. We enable users to select from similar alternative shopping items, to manually remove and adjust product quantities, and to review product details, including the nutrition content. Any ingredients used in more than one meal will be shared across the meal plan to avoid waste, automatically adjusting quantities. Users can see which shopping products are used on which days of the meal plan and navigate back to the meal details screen to view the nutrition values of the overall recipe along with the preparation method. The app includes other smart features such as expiry date warnings, marking any ingredients that may expire before use. Throughout the project, Ocado Group has been working across all the partners to collaborate on the product view that brings together the nutrition experts and technologists in the development of the app. Ocado Group has also been leading the work to identify the market and business opportunities for the outcomes of the project and how each partner can generate value from the protein ecosystem, methods and datasets.
I'm Saverio Gravina, Head of Research and Innovation Project in Data Wizard, a small medium enterprise focused on digital innovation, in particular for e-health and healthcare domain, we can say. Our main contribution is to work on the development of the expert platform and the system integration of the different parts of protein ecosystem with, the mobile application between the expert platform and also because it's more technical oriented task, we can say, but also this is part of our life, everyday life. So it was really also, and it's really good, and I think that we, as entire consortium, I think that we did a very great job in doing protein. Actually, because I think that protein mission is to support everyday life needs that people have, from diabetes and other nutritional disease that are quite common today. So I think that it's really, really amazing and really a very challenge, we can say, to mission that we had in protein. And so I hope that also and I'm pretty sure that we will continue with protein to develop and design everything, and to improve our projects. Nowadays there are a lot of products that can support diabetes patients and people with nutritional disease. But as a research project, our mission is also put together innovative technologies that can work together and support in a new way. This is the mission, for example, with the AI advisor. For example, a user can upload a meal plan and every day can also change a little bit the nutritional plan, but in the same time with AI tools we can support the user to say, okay, now your nutritional plan can be changed in this way. And of course this is really based on knowledge behavior that comes from the experts. So the nutritionists and physicians can follow the patient in an innovative way with, I think, less time consuming effort, and also to receive knowledge from what the users is doing. That is really, really, good today, and is the base, the future, we can say, line that we can proceed in this way. Of course, this, we can say, empowering also tools should be supported and are supported in protein with a very great user experience, because all the health services generally start from a user experience point of view. So in the first phase of the project, we worked together with all the partners to design the user experience, to know how is the, we can say, patient journey, or also general people journey in everyday nutritional behaviors and attitudes. So this is very important because we can understand how they interact with a mobile application that is going to suggest them how they eat, but it's not simply IT advice, or is based on a knowledge that we collect during this period, during this project. So I think that in the future we need we should work on this line, because it's a very good opportunity to improve the healthcare professional, we can say, work life, and in the same time the lifestyle and the well-being of the people.
That's great. Thanks so much. Super. So that was fantastic. Thanks very much. This will conclude the first part of the webinar, but remember to add your questions to the chat, to the Zoom chat. We'll be addressing these later in the webinar. So we're going to take a 5-minute break now, but before we get started on the second part of the webinar, so take a break, but also please go to the Slido, which is on the chat. It's a questionnaire. We want to find out where people are coming in from. And wow, it looks like we've got a huge range of locations people are joining from. The most popular cities are Prague, Lisbon, and London so far, but we have people from Bucharest, Manchester, Berlin, Thessaloniki, Leeds, Dubai, Boston, Coimbra, Madrid. Impressive. For those of you who are still around answering the questions, we're also asking for you to describe your current position or role so we can figure out why you're interested in the Protein Project. Are you a healthcare professional, an industry partner, a public health representative? Are you involved in government? Looks like so far we've got 51% academic representatives among our delegates and a lot of healthcare professionals as well. We also have industry, NGO, public health representatives. So we're also asking which part of the Protein Project you are most interested in from what you've heard so far. So far, our responses are personalized nutrition, which is a very important and popular subject right now across nutrition and across the AI community. Some people are interested in sensors of biomarkers, protein intake among the elderly, the mobile app, the sensors, and everything. Finally, we ask whether you might be interested in downloading and using the Protein mobile app. So you'll see that question on your Slido. Welcome back, and thanks for participating in the poll. We appreciate it. So now we're going to describe some key findings from some of the pilot projects implemented as part of the Protein Project. In the video we're about to show you, you'll first hear from Dr. Maria Hasepadou, who will present on from the International Hellenic University, who tested the Protein app with people living with overweight and obesity, as well as with athletes. Our second presentation will be from Dr. Elena Patra, who will share with us how we engaged with nutrition and physical activity experts to integrate nutrition and physical activity guidelines and personal information into the algorithm, which created the personalized nutrition and physical activity recommendations for end users. That's a mouthful. Then you'll hear from Dr. Elena Lalama, who will discuss the pilot projects implemented to get feedback from people with diabetes who are using the Protein app. This was done by Charité. Our fourth speaker, Dr. Duncan Russell, will describe how Ocado tested the Protein app with healthy individuals to help them customize their grocery shopping to support healthy eating patterns. Our final two speakers are Dr. Eugenio Mantovani from the Free University of Brussels, who will discuss legal and ethical aspects of the project, and Dr. Maria Vasiglo, who is a registered dietitian and a member of the Protein Scientific Advisory Board. At the end of the video, you'll also hear some concluding reflections from protein partners about their experience working within the project and their ideas for what could be future research.
I'm Maria Hasapidou. I'm a professor of nutrition and dietetics in the Department of Nutrition and Dietetics of the International Hellenic University, IHU, in Greece. I'm also chairing the nutrition working group of IASO, and I'm also chairing the ESD and obesity of IFAD. And with all these, let's say, different roles, I'm interested in protein. I was interested from the beginning on the area of personalized nutrition because this is the main goal of protein. And I was also interested on how this personalized nutrition could fit better, let's put it like that, in the groups that my department and as a partner is working for protein. That means we're working on all individuals, people with overweight, people with obesity, and athletes, or people that they exercise systematically. So we are mainly, our role in protein is to work with these three different groups and to implement what we call the pilots. That means that we have, when the app was ready, a number of people with obesity, people with overweight, and athletes to use the app and see how useful the app was and how helpful it was, depending on, of course, on the target group. For example, for the overweight and obese, if it was helpful for them to have a better, a healthier, let's put it like that, nutrition, and maybe help them to lose weight if that was the purpose. And for the athletes, if they could make, help them to have a better athletic performance. So having that in mind, of course we did our best because the purpose was to use as many as possible the personalized data. That means for a number of these individuals, we had genetic data, we have microbiota data, we have of course dietary data and physical activity data. We were using the VOC, and we're also using what we call the smart belt, getting data from these sensors. We have a number of sensors used in this project. And at the end, we are trying to have a more personalized nutrition and give more personalized, let's say, dietary advices.
The International Hellenic University, as part of the consortium, has been involved into the project in essentially two main ways. The first was a nutrition and physical activity expert advisors in order to develop guidelines and rules for the AI advisor, feeding recommendations of personalized nutrition and physical activity into the mobile app for end users. The second way was piloting the experience and demonstrate the app and end products with final users. We were involved with piloting around people with obesity, people with overweight, and athletes, as well as leisure exercisers. The process was really challenging, as well as very rewarding. We tried to reach to as many people as possible, getting all sorts of very useful feedback, and we're really excited to get to see the results really soon.
My name is Elena Lalama. I come originally from Ecuador, but I am part of the protein project that is taking place partly in Berlin, in Germany. We are working together in Charité, a university hospital, with my supervisor, Andreas Pfeiffer, and my colleague, Marta Sanalosi, and our study nurse and our study doctor that are helping us with the recruitment of the project. We are Pilot 18. We focus on people with type 2 diabetes, and we are introducing the protein app. So far, it's been really exciting. We have recruited 25 patients that have started with the app, and we have a little bit of a mixed feedback. Some people love the app. They say it helps them pick healthier choices. Some people have started doing more exercises because the app recommends it. They don't do exactly what the app says, but they're motivated to have a healthier choice when it comes regarding to lifestyle. We've also had not as nice comments, for example, that the app might be too complicated. And we're based in Germany, our pilot at least, and the database of the foods is in several languages, sorry. So not everyone speaks English, and they're having trouble in finding certain ingredients or, for example, also registering in the app. It's been definitely a very exciting project. We have learned a lot, especially my colleague and I, this is our PhD project. So we are learning and doing everything at the same time with the help, of course, of our supervisor. And we have gathered a lot of samples that we are very eager to analyze with the other partners in the consortium.
The Protein app with the Ocado.com shopping functionality was piloted by 178 people over a 6-week period. The trial participants were from the healthy user group for remote online users. We excluded candidates that would be covered by other pilots running the project by partners that would closely monitor health conditions during the trial. Each week, the users were asked to answer 5 questions about their experience of the app during that week. We incentivized our participants with vouchers after week 3 and after week 6 at the end of the trial. In addition to the questionnaires, the participants' behavior was analyzed through their interactions in the app, such as meal confirmations, star ratings of the meals and activities, meals added by the user, and when they used the app. Based on the results of the weekly surveys and the interaction data, we were encouraged by the level of positive engagement we achieved. We saw high levels of trial participation, starting off with 178 participants in week 1 and ending with 171 in week 6. Feedback showed that our users were very positive about the concept of the Protein app, and that Protein helped them organise their shopping and inspired them with new ideas. Users were also willing to rate meals and activities and reported that this improved the suitability of recommended meals and activities in their personalised plan. Some of the challenges reported by our participants included difficulties using the Add Meal and Add Activity feature, the ability of the app to be customised to certain parameters and daily routine, including the number of meals and activities per day, suitability of meal recipes to regional tastes, and customising to their shopping budget. Ocado Group's involvement in the Protein app has provided many insights into the trend of healthier shopping choices. In particular, the customer needs for personalised nutrition and meal planning, along with the major barriers such as tracking food consumption. The knowledge we have gained from the project could be used to inform the development of new capabilities within our own e-commerce solutions. For example, by making it easier for users to understand the nutrition value of their shopping basket and helping them manage their nutrition through meal planning and recipe recommendations. A protein-style solution could improve the search and recommendations for our e-commerce products and create new approaches to personalisation. The aim will be to save customers time when shopping online and to create an even more intuitive user experience by providing the means to shop from recipes and meal plans. This could help users reduce food waste through the option to create weekly meal plans that share ingredients and manage fresh food exploration. We want to inspire web shop users with targeted recommendations for recipes and products by getting insights into what they have bought in the past, but also what they might like to buy in the future. Furthermore, we want to ensure users can access the widest choice of products through a personalised shopping experience and proposition that suits all different types of customers in a global grocery market.
So my name is Eugenio Mantovani, I'm an Italian national, but I work here at the Free University of Brussels, the Vrije Universiteit Brussels. And what we do there is actually we interrogate the intersection between a society that is more and more populated by technological advancements and human beings, the people. We tend to look at the technological developments from mostly a legal perspective. That means that our primary concern is when you run a research, whatever the reason may be, there are excellent, benevolent, positive reasons. In any case, you're putting your hands on human beings, the so-called research participants, and you want their data, particularly in such data-intensive technology like in this project. And when you do that, even if you do it for the most positive and humanistic reasons, you want always to check that you do it properly. So that's where ethical principles kick in, and also when law kick in. There are some rules concerning in particular what you do with your data, and we want to respect that. So sometimes our role is hold your horses, careful. Have you thought about the possible impacts? Is there any risk? And that's more or less what our role is in a project such as Protein. So as the researchers, very knowledgeable researcher, they go and involve patients or other research participants. Yeah, we want to make sure that that is done. So now we are approaching the end of the project. So you may wonder, okay, where are we going? Where is this app, the Protein system? What will it do? And you may ask yourself what kind of change or impact it may have on normal people. Because after all, these days we look very often, maybe too often, at our smartphones, but sometimes we can do it maybe for the good reasons. So in this case, I think that we are going towards times where we pay more attention to what we eat, our physical activity, and we want to keep a record of that. And that's all right. The only thing is that that's only part of the picture, of course, keeping records, checking out, and then there is life, and life is also made of mistakes, of excesses, and so I think we can use this technology, but we never want to forget that, there is the human person with all his hypocrisies and weaknesses, and also strengths. So yes, so my thought would be, I hope that technology like this can help make life of the people better, but don't become obsessed. Your food, your physical exercises, they're just fine. You're fine as you are.
My name is Maria Vasiloglu. I am a dietitian nutritionist, and I'm the representative of IFAD in Protein Project. My expertise in digital technologies for nutrition, and especially for dietary monitoring and assessment, were really related to the Protein Project's objectives in relation to the creation of tools that support personalization. So that was on top of my interests. The role of the Scientific Advisory Board, and which I am a member, was to provide constructive feedback, guide, and give suggestions throughout the duration of the project. The initial project's ideas were groundbreaking, and indeed, the preliminary results that we're presenting these days are very promising, implying that personalization is the key aspect for better health. I believe that Protein can transfer important knowledge to the research community, and further knowledge can leverage the project's achievements to build advanced solutions. My overall experience is very positive, having also shaped excellent professional relationships with the project coordinators.
Well, of course, towards the end of the project, and what I found fascinating and interesting was also the collaboration with people from other disciplines. I keep on saying that we are the people that were working with the pilots, we're the people that we see, the patients, the physicians, the nutritionists, the dietitians. And at the same time in this project, we were collaborating with computer scientists and sometimes we sort of have a different, let's say, approach. For example, they wanted to have big numbers, to have big data, and our approach was that we have to have smaller numbers because this is a better way of getting in touch with, you know, with the patients and getting more information from them. And it was, let's say, an adventure, and it was a great journey because I learned a lot, the way they think, the way they work, and I believe they learned from us as well. So I ended up by saying that this project had that, let's say, excellent collaboration between scientists from different disciplines, and that's let's say, very helpful at the end of the day. That gives you results, and we can see that in this project. Furthermore, I would say that something that will be left out of this project is that, of course, personalized nutrition is not an easy story, and we're not get there. We're not, yes, we're not there yet, but we're hoping we'll be there in a few years, or I don't know, I cannot really say in 5 years or 10 years, but I believe that this project is a great base with all the data we sort of gathered, with all the, you know, all this analysis we've done, and I believe this is going to be very helpful for the future EU projects. They can really use our results and go further and, you know, go to the next step, let's say, scientifically, because I really believe that personalized nutrition is the end goal, like personalized medicine as well. Like, I mean, we have to keep in mind that the person is in the center, and we have to get as many information as possible. And the most difficult part is how we're going to connect this information. And I think with all this work we did, we give a lot of new, let's say, results and ways of thinking that the European projects can use.
So this project has been really challenging for a lot of reasons, but actually it's also been really exciting to work with such a diverse range of people, and particularly I think we've all found it in equal parts challenging and exciting to try and understand very different viewpoints. So myself coming from a nutrition angle, chatting to someone who is a software engineer, and we have very different languages and we have very different agendas of what, you know, what success looks like for us. And I think it's been really good to try and see how we can bring those two together. But I think what we've created has got huge potential. You know, we know there's a lot more work that could be done, but actually this idea that we can create a personalisation system that's dynamic, that's the novelty here. So it's not just personalised at the point of entry, but the more the user interacts with it, the better it gets. And that's what we're really aiming to do. Yes, there's work to be done on the user experience side, but I think the underlying technology is really amazing.
Due to COVID restrictions, as everyone knows, we've had a lot of issues and a lot of challenges trying to get this study started, because we're a very big consortium, but we've managed to go through that, and we started our study. We genuinely believe, even though the app may have had some issues, that after fixing them, this is definitely the future. I mean, the future is already here, pretty much. And what we're trying to do here is to also connect glucose levels. We're using a glucose sensor with the application, so that the application, through artificial intelligence, is able to tell you what you should eat and what you should not eat, depending on your glucose levels. But all very individualized, depending on your health, and without omitting foods. As an example, we have people with type 2 diabetes that said before, yeah, I'm not allowed to eat bananas because bananas get my sugar high. But then when they eat it, how the app suggested, it's all fine. So this proves that nutrition is personalized and there's no one size fits all.
Well, it's quite an emotional moment for me, because we are right after the end of the final physical meeting of the project, and we had a great productive two-day meeting, and we realized at this point that the extent of what we have done all these years during the protein project we have produced an important framework, technical framework. The highlights of this framework being an application for the smartphone and also a dashboard for the experts, nutritional experts, medical experts, dietitians, physical activity experts, and a whole framework behind these two tools that is very useful for research purposes and obviously has some exploitation value. It is really important that now, after 4 years of work, we finally see the fruit of our labor, and we see also the prospects for future research, because we are conducting still a number of pilots. We have already conducted many pilots with hundreds of users, and having gathered data from these pilots, always in a safe and anonymized way, we now see how we can process these datasets for further research and even further research opportunities, but also how we can exploit the technical aspects of the project for further exploitation. Having seen everything that we have achieved during this project, I'm absolutely convinced that this is the way forward to the future research in this area.
Thanks so much. Wow, I love those reflections. It was great to see, to hear from everyone who's participated in the project around, their views of the project, the progress. Thanks to everyone for participating in our polls, and thanks for putting these great questions. We've got great questions in the chat already. And it's time now for our live roundtable discussion. So I am pleased now to welcome Dr. Eugenio Mantovani from the Free University of Brussels, who's going to moderate the roundtable discussion. Welcome.
Hey there. Okay, hi everybody. Thank you, Cherie. Well, we had quite a few questions. Please keep contributing if something pops up now. So there is Georgi Staikov, I hope I pronounce it right. Well, actually, he asked how much time it took to develop the app after the materials, the logic, the content was available. And then he would like to know how many developers worked on the project. And then he adds a nuanced question, say, if it was an external agency, it would also be useful to know the ballpark of human resources used. So I take it that Georgi wants to know overall what kind of effort in terms of man-force, research, time requires to develop an app like Protein. I think probably this is a good question for our coordinator, Lazaros, or if anybody wants to intervene.
Well, regarding the duration, first of all, before answering this question, I should say that this was a research project, so one should not compare the resources that we used during this project with what he might expect from an industrial partner. But more or less, the development of the application, along with the dashboard after the design phase, got us around a couple of years. And then we had one more year for testing both the application and the dashboard. And regarding the number of developers, there were 5 organizations that were involved in development, with a few developers each. But again, I should stress that, for example, one of the organizations was CERT. CERT is employing mainly researchers. And of course, our researchers also did a lot of coding, but you cannot compare the efficiency of this work with, when you have a project for an application in a company.
Yeah, so overall it's a collaborative project where there is a strong research component, and that takes time. Well, maybe you can stay on, Lazarus, because actually I'm jumping to the question asked by Charlene Ding, who asked actually which technologies and sensors have been studied to track food intake. It's more than one.
Yes, I would pass this answer to Cosmas, who will probably.
Yes, mainly we use the mobile phone, so we collect data from the mobile phone, but also for the biomarkers, we use the smartwatch and the smart bands, which communicate with the Google Fit. So every sensor that communicates, that can be synchronized with the Google Fit, can provide information to our system. But for the food, we use the mobile phone. So all the information from the interaction of the user with the mobile phone is sent to the cloud, and we analyze this information in order to provide personalized recommendations.
Also, I would like to add, if I'm allowed, Eugenio.
Yep.
Specifically for food identification, we used the video, the camera of the mobile phone, and also we used a smart band for eating behavior analysis, tracking and analysis.
Yes, this is a research work that we did in order to estimate the eating rate. So we analyzed the video of the user in order to estimate the duration of the meal and also the eating rate. And for the automatic recognition of the food, we use the camera of the food. So we develop a food image analysis, which recognize automatically the ingredients. And of course, we support two modes. One is the manual, so the user can enter the information manually, but also the user can use the camera. Otherwise, we collect the data from the phone, as I said before, so the user can say that, okay, I followed the recommendation, and also there is a rating system that helps us to understand the preferences of the user, and this is an important information for our recommendation algorithm.
Oh, thank you very much. Of course, dear guests, if you want to add other questions, if you're not satisfied with the answer received, you can always add something to the chat. But so it means that we extracted a lot of information above the skin, but also part of research went really below the skin, and that I'm referring to the genetics study. And there was a very interesting question that was asked earlier, and was about actually the integration of genetic information in the ecosystem of protein. So maybe Konstantinos, you want to expand on that? You gave an answer through the chat room explaining that actually this is just the beginning of a journey, and therefore that is not part of the protein application as finalized now, but it's a sort of experimental.
Yes. Hi everyone. So I would like just to add here that the inclusion of this gut microbiome information, and in particular, moreover, the genetic background information, will provide an extra layer of an extra level of information regarding personalization. Okay, based on the current knowledge and the literature, there are many different research trials that aiming to include this kind of information. There is no strong evidence. Okay, so our study, I strongly believe that it will serve as a baseline for future trials on this field.
Yeah, So more is coming. Cherie, you interrupt me if I'm going too long, because actually there are a few questions. So please tell me when I should stop to give the floor to actually Yanis, as originally scheduled. There are some practical questions that were asked by Maria Renata, by Arthur, and other guests. Notably, the availability of the app is only is limited to Android for the time being. So that's
that's true.
Right. And as far as, of course, there is nutrition. We speak different languages when it comes to nutrition. And so also that is something that should be attended to. Cherie, feel free to interrupt.
Sure, that's a key part of the project, isn't it? Is that ontology. And actually one of the key innovations in the project, I think, was the developing the ability for nutrition scientists and computer scientists and AI specialists to connect and have conversations. I wonder if we might introduce Yanis now to have to talk to us a little bit here, because he has something to say.
Yes, thank you, Siri. I just share my screen. Hopefully you can see this.
Perfect.
Yeah.
So this is a presentation about the protein ecosystem and all the exploitable assets and the data sets the protein produced during its course, and those are either commercially available or openly accessible. So we have the intellectual property landscape. So the main asset is in the core of protein is the mobile app that's based on AI, artificial intelligence. And the assets that complement and extend the features of this mobile app are divided in, let's say, 4 groups. It's the personalized plans group that includes the AI recommender, the knowledge base, databases, and the experts dashboard. We have the record group, which includes sensor-related assets such as the volatile organic compound sensor, the VOC, and the smart palette, as well as algorithms for calculating the eating rate and the food intake. The motivate group of assets, which includes the dietary games and the gamification perks, and also the managed group of assets that extend the user's personalized preferences to restaurants and supermarkets. I will not go through the offerings from each of these groups, so I will not go. So you can find them if you go to the download the Protein mobile app from the Google Play Store. And as other people mentioned, this app is at the moment available only for Android devices. And there's also a special version of the app that includes the online shopping feature and is available only in the UK at the moment. For this, you will need to contact us first. The iOS is in the is planned as a future work. So regarding the personalized plans and the experts dashboard, Protein supports the experts, nutritionists, dietitians, researchers, etc., in their monitoring of their patients' progress, the choices in their daily routine. And the Protein expert dashboard is also available for trial upon request. Now we have the AI advisor that was mentioned before. It's that artificial intelligence is in the core of the Protein system, and this technology, the AI technology, is offered by components, by several components such as the reasoning-based decision support system, the food and activity recommender, the readaptation manager, the early warning subsystem. We use also user information about the user's profile, their meals and activities, and also the ontology that has been mentioned, that's all approved by domain experts. And all these are combined to personalize meal and activity plans for each user. Now, the special knowledge database that has been mentioned already by the experts who collaborated to develop these appropriate nutritional requirements for all the project user groups. This is a database of the project for nutrition requirements that was created to incorporate EFSA or other governing body guidelines for the total energy intake, for macronutrients, protein, fat, and carbohydrates, key macronutrients, iron, calcium, etc., fiber, fruit, vegetable portions, and other things as well. Now we have the ontology, also a core part, as it has been mentioned by my partners. Some key classes are shown here, like foods, nutrients, activities, conditions. Also the key relations and the rules that link them. They are shown here with examples with the relations. And we also have, we had to keep in mind this trade-off that was made for the food and nutrient relations with regard to the reducing computational complexity. Not all nutrients per food and food group were included. The selection was based on importance, for example, a high presence of nutrient per food or group, plus it was based on which nutrients were most relevant to the expert-defined user goals and conditions. We had several sensors for record and track. The protein as a whole was designed and implemented for compatibility with sensors, sensor-based devices. At the moment, protein is integrated and compatible with a VOC sensor, the volatile organic compound sensor, the smart belt, and the continuous glucose monitor, and as well as Cosmas Dimitropoulos mentioned, the Google Fit application, which offers connectivity to a range of sensor available in the market. Now we have the nutrition tracking, artificial intelligence, which is basically the algorithms that are being used, were developed and are being used for calculating users' eating rate, as well as the food intake, and the library that was integrated with the app to allow for the integration with other sensors as well. We have the managed group of assets. We have, this is the shopping and dining out features. So a protein app includes shopping lists that are connected to online stores, allowing the users to manage their shopping. And the app is also connected to restaurant menus, extending the user's personalized experience to a restaurant's premises. Now we have the gamification stats, gamification and statistics. All users are motivated to achieve their goals using gamification, notification, and reminders throughout the app. And this includes also the daily statistics such as calorie intake, exercise duration, water intake, and their overall progress and achievements. We have the dietary games. These are special games, and the app contains links for these games. These can be very informative and educative for people, especially kids, on nutritional related topics and in general on how to achieve a healthy lifestyle in a creative and entertaining manner. As a consortium, as a project, we participated in the innovation radar of European Commission. So all the assets of protein were assessed and evaluated by the consortium. We then positioned them in a 2D plane according to our assessment on their exploitation potential and their innovation level. And the most innovative, with a high exploitation potential assets, are positioned in the top right corner. And this group of assets includes the protein mobile app as a whole, the video-based eating rate estimation algorithm, the VOC sensor, and the smart belt. Regarding datasets that are open, are available for in open access, we produce research content that is publicly available on Zenodo platform, including research publications and also dataset validated by experts with data related to meals, recipes, foods, with nutritional content and physical activities. This dataset is available in 7 European Union languages, and also white papers on the technology used and the results and other topics are also available on Protein website. So check this if you're interested. Now we have also commercial datasets that are being offered commercially, and the project databases, the knowledge base, ontology, datasets with food-related data, user-related data, etc. These can be acquired upon request. So get in touch to find out how you can get access. And that's all from my side. Thank you for your attention. We would be very happy to get in touch with any of you who might be interested in protein ecosystem and its outcomes. And don't forget to check our website and some videos about our innovations and assets. Thank you, Siri.
Thank you very much, Yanis. So we just have 5 minutes to go. Please add your question. I would like to ask Kat to intervene because there have been some questions about the possibility of expanding the boundaries of protein geographically, meaning reaching out to other non-European cultures. And another one was about how we managed to deepen the knowledge of users. Notably, Bogdan was interested about how we take into account allergies or intolerances. Kath, you want to add something about this?
So I'll take the allergies first because that's fairly straightforward. So as I put in the chat, that was one of the key features of the user profile. So we're very aware that, as you've noted, that it's important that the app's not recommending things to people that are not suitable. So we ask them about their allergies or intolerances, but also there's an opportunity for them to identify if they follow a particular diet, for example, a vegetarian diet, and that can all be entered as part of the user profile and just contributes to the filtering system that's within the app. So clearly, if they put a number of allergens and dietary preferences, it's going to limit the meals that are available for them, but certainly the app is able to cope with people wanting to avoid any of 24 allergens we had included in there, and to say some of the key diets too. And in terms of, expanding it, I think, well, as Lazarus has said, a huge amount of work went into developing this, but now that structure is all there, in theory, and this is coming from me, a nutritionist, not a computer scientist, it is relatively easy to now adapt the system. We can change what's in the knowledge tracker, which feeds into the filtering mechanism to reflect the dietary recommendations of other countries. We can change the translations, again, that's work, but it's certainly feasible to do. We've added other languages as we've gone along, so that's another option too. So yes, I think it is possible, now all this hard work's been done to actually expand this to other areas outside of Europe.
And also, if I may add to that, when you expand, you also have to take into consideration the normative framework. So that's the question that Arthur asked, and that was about, indeed, in the European Union, we have a common framework, which is given by the General Data Protection Regulation. And that's all right, because it enables a flow of data under common rules. But since we're dealing with the nutrition, so there are medical aspects of it, there are specific derogations that apply in the member state. So everywhere where you download or you use the app, we tried to comply with the legal conditions that are prevalent in each of the other countries, particularly for what concerns the processing of sensitive medical data. So that was my bit, because I actually was mostly involved in that line of work. And there are some more other logistical question concerning Vera. For instance, she asked what's the place of Protein Project within the universe of H2020 call, and also some technical issues concerning the availability of presentations. So I'll for framing protein within the beautiful world of H2020 projects, I give the floor to Lazarus, and instead, Cherie, can you please inform our guests about the possibility of accessing material?
Sure, let's let Lazarus speak first, please, and I'll conclude.
Well, yes, it is through the protein application, and everything that you have seen today was developed within the context of a European Commission co-funded research project. It was under a Horizon 2020 call, the proposal for this project.
First of all, thanks everyone for a great discussion. I only wish we had a little bit more time. I think we could have carried on, and almost every individual who joined stayed on and stayed online. But please do connect with the project, visit the website, engage with our material. And we're so grateful that you joined the showcase and are so pleased with your interest in the protein project. Thank you.